Okay, so we will take, the first bill is House Resolution 5070 by Representative McNamara. Representative McNamara, you have the floor.
Thank you, Mr. Chairman and members of the committee. House Bill 5070 is a House resolution respectfully requesting the Department of Behavioral Health Care and Developmental Disabilities to fully address previous violations and to take all the necessary actions to ensure ongoing compliance with the Federal Mental Health Parity, Addiction, and Equity Act. The intent of the bill can be summed up on page 2 and lines 24 through 27. Whereas no health plan subject to the jurisdiction of the state of Rhode Island should be permitted to improperly reduce the level of care for people needing mental health and substance use treatment or limit treatment of care, acute care. Denying people with chronic mental health and substance abuse conditions ongoing treatment is now, therefore, be it resolved, prohibited. So this addresses the disparity between chronic physical illness and chronic mental illness. COVID-19 has increased the demand for good mental health services, substance abuse, suicide rates, and this is a simple resolution that asks the Department of Behavioral Health Care to comply with federal law. That's it. Thank you. I'll take any questions.
Thank you, Representative McNamara. Are there any questions from the committee? Hearing none. Representative Kassar, please.
Yes, thank you. Thank you, Mr. Chairman. Sorry, I'm not sure of the process, so I'll just raise my hand.
Thank you.
Thank you, Chairman McNamara. Good to see you and nice to be back in committee and getting to work. In regards to this resolution, you mentioned sort of COVID, but I think my question is coming into this, what is the problem that precipitated the need for this resolution? Because we have OHIC on the one hand for commercial plans, we've got EOHHS on the other hand for Medicaid and parity, and I absolutely believe that the more attention to mental health parity, the better, because we've got a lot of work to do. But is there a specific driver that we're looking to address with this resolution? I'm sorry, I can't hear you, Chairman.
Yes, Rep. McNamara.
Currently, the greatest disparity that I see that's been amplified by the COVID isolation that people are feeling and sensing is the disparity that exists in treating individuals with substance abuse and their treatment. I know of no other chronic illness that can be diagnosed and then not adequately treated and covered by insurance companies. I see that as a big disparity. We're currently under court orders for the developmentally disabled that prohibiting the old sweatshops that we used to force them to work in. So, but the impetus behind this was my former colleague in the House of Representatives and Congressman Patrick Kennedy. He is advocating for this nationally, and it was put in conjunction with his national organization.
Great, thank you. And is there an enforcement piece for BHDDH at this point? Or
It's simply a House resolution asking them to address the issue. That's it.
Thank you. I appreciate it. Thanks so much.
Thank you, Representative Kassar. Are there any other questions from the committee? Okay, Representative McLaughlin, please.
Yes, I'd like to address this to Chairman McNamara. Chairman McNamara.
Yes, sir.
In reference to the COVID, okay, there's been some national, stats that have come out in reference to you know, people would, you know, that are suffering from drug overdoses and stuff like that.
Yes.
You know, could you elaborate on that?
Yes, certainly, Representative McLaughlin, you are correct. There's been an increase specifically in Rhode Island with individuals who are overdosing. And one of the things that did not help was the first stimulus check that was given with people who are suffering from an addiction, and you give them $1,200. Unfortunately, it doesn't end well. And I know I've had constituents that have loved ones that are in addiction and trying to get treatment, Representative McLaughlin, and you are right. You know, you hear people say you have to let them reach bottom. But with the opioid and fentanyl addiction issues that we're facing, hitting bottom is death. So you're 100% right, Representative McLaughlin. Thank you for your question.
Thank you, Chairman.
Are there any other questions regarding Resolution 5070? Hearing none, I will close the hearing on Resolution 5070.